Hi, good afternoon. This month is Endometrial or Uterine Cancer Awareness Month, and to talk about it, we have a very well known and leading women's cancer surgeon, also called GYN oncologist, here, Dr. Aparna Kamat. Dr. Kamat did her medical school in Mumbai, India. Then she came to United States, trained in OB-GYN residency, and then did fellowship in GYN cancers in the prestigious MD Anderson Cancer Center. Subsequently, she joined faculty at Weill Cornell Medical School, and she heads the Department of GYN Oncology at the prestigious Methodist Hospital in Houston, Texas. One thing very unique about her is that she regularly keeps in touch with the medical scene in India and therefore is able to keep up with what goes on both sides of the globe. So we are very fortunate that she took time to talk to us about uterine cancer. Dr. Kamath, welcome.
Thank you so much for that kind introduction. And I'm so glad that both of us can talk a little bit to raise awareness about uterine cancer and endometrial cancer during this very special month.
So, this is the Uterine Cancer Awareness Month. And tell me about what it is and how prevalent is it on both sides, because we have audience on India and US as well.
When they talk about uterine cancer, there are different types of cancers that can develop within the uterus. The most common kind of cancer that develops in the uterus is within the lining of the uterus called the endometrium, and that is known as endometrial cancer. Now, that cancer in the Western world is the most common cancer by far. In the United States, we see approximately about 65,000 new cases. As if you compare that to cervical cancer in the United States, we see only about 11,000 cases. So it's very, very common here in the US.
So it's the most common women's cancer, women reproductive
cancer. In India, actually, endometrial cancer is on the rise. And we'll go a lot into some of the risk factors. But yes, even in in India and in Southeast Asia, we are seeing more and more cases of endometrial cancer and also cancer among women who are younger. So it is really important for people to know, what the risk factors are, what the treatment is, because this is luckily a cancer that is still very highly curable.
Excellent. That's very good news. So you kind of mentioned about the risk factors. Can you elaborate? Are they same on both sides of the globe? Are they different? Or?
Sure. So, there are different types of endometrial cancer. We call one a type 1 and one a type 2. The type 1 endometrial cancer is the one for which all the risk factors really pertain. This is called endometrioid endometrial cancer, and it actually is caused because of too much of estrogen, excessive unopposed estrogen in our system. And so there are many, many different conditions that can actually cause us to have too much estrogen. So one of the most common conditions that we see, which is linked to endometrial cancer, is obesity. So women who are overweight or obese produce a lot of estrogen, which is actually created within the fat cells of the body. And so that's why when they're postmenopausal, you get a lot more estrogen than you should get. And that can result in endometrial cancer. In fact, we have found that, with the obesity epidemic, you can see that the number of obese people are going up all over the world because of different dietary habits. The rates of endometrial cancer have also increased, especially among younger patients. So in the same way, along the same line, we also know that there are chronic conditions such as diabetes and high blood pressure, which have actually been found to be independent risk factors, in the sense that by themselves having that, for whatever reason, increases your risk. And then one other condition that we see very commonly among younger kids and younger women is something called PCOS, or polycystic ovarian syndrome. And I'm sure a lot of women have heard of this because it can cause difficulties with getting pregnant, difficulties with their periods and things like that. And all of these increase your insulin resistance. And so all these have been actually associated with increased risk of endometrial cancer.
Unfortunately, all of these have gone up not only in US but in India as well. All the
Exactly.
risk factors. Yeah. So when you one thing I'm very happy to learn about is that a lot of these are modifiable.
Correct.
So the woman can help herself,
Yes.
knowing that these are the risk factors that can be modified. I mean, genetics you can modify.
Right.
Yeah.
So one of the things that I think is really important about knowing about endometrial cancer, like you said, there's so many of these are modifiable, right? So for example, we know that endometrial cancer tends to behave so a little bit like colon cancer, in the sense we form pre-cancerous conditions that then turn into cancer. So there are many, many different ways in which we can actually try to prevent it from occurring. So, for example, if we know someone has PCOS, those women, if they're put on birth control pills, that itself can be, somewhat protective. If you know someone is overweight, losing weight, even 10 pounds, has been shown to have a significant effect in overall health, but also in their risk of endometrial
That's very
cancer.
encouraging, yes.
And so there are many other things. There's also women who are on have had breast cancer, and they are put on tamoxifen. We know that tamoxifen sometimes can increase your risk of endometrial cancer. So just knowing that and being vigilant about the signs and symptoms can help us catch this cancer at an early stage.
So can you tell us a little bit about what a woman has to look for as far as signs and symptoms?
Yeah, so one of the things at the beginning I said that endometrial cancer is curable, and the reason for that, in most cases, it actually causes symptoms very early. So one of the most common symptoms that someone will present with is postmenopausal bleeding. So once you go through the change of life, when you see that you're bleeding, most women know that this is not normal. So having any kind of bleeding after the age of, once you go through menopause, even if it's just a little bit of spotting, some pinkish discharge, all of that should make you go see a gynecologist. And because of that, since it causes symptoms very early, it tends to get diagnosed at an early stage.
So they are seeking help early because of the
symptoms.
signs.
So this is the most common. Now, obviously, if the cancer is advanced, it can cause other symptoms, like it can cause pelvic pain, it can cause difficulty with going to the restroom and things like that. But that's usually in more advanced cases. The most common side effect or the most common sign to look for would be abnormal bleeding after menopause.
That's a very good point. And you've suggested other risk factors, how to modify them as well. Is there, a lot of people are using the medications to lose weight.
Yes.
Is that okay to lose weight that way? Will it reduce the cancer?
So, actually, I'm glad you brought this up, because this is an area of research that I'm actually doing right now. So there was a recent study that was published in JAMA, which looked at women who are diabetic, who were treated with either insulin or they were treated with these GLP-1, like Mounjaro and Ozempic, all the new drugs that we hear. So when they were compared these women who were treated with either insulin or one of these drugs to control their diabetes, and they followed these women to see what the risk of certain cancers, which are called obesity-associated cancers, of which endometrial cancer is one of the biggest ones.
And the others are?
The others are pancreatic cancer, liver cancer, ovarian cancer, breast cancer. So all of these. But when they looked at that, they actually found that women who were using these medications actually had a lower risk of developing endometrial cancer. So it was found to be protective. And we know that, using these drugs, they can help women who are struggling to lose weight, and that has been shown to have benefit even for their cardiovascular health, their diabetes, their hypertension. So obviously within reason and with the help of a
Under supervision,
under
yeah.
supervision, I think it is reasonable for
It's
patients
encouraging that,
to look
yeah.
at these medications.
What about this, other than the symptoms and a woman seeking advice, like for well women checkup, is there any screening
Yeah.
tests that can be done?
So unfortunately, we actually don't recommend any kind of screening. The reason for that is, sometimes people will ask me, well, why don't I just get an ultrasound? Because that's one of the things that we do. So if I just get an ultrasound, maybe I'll be able to find if the lining of my uterus is thicker than I should. But what the problem is that, these are very non-specific tests. So if you just get an ultrasound without any symptoms, it can cause you to have unnecessary procedures, biopsies that are not needed and things like that. So right now, for screening, we don't really recommend any regular screening. What we do say is that you should see a gynecologist once a year. And for that, it would be good so that they can do a pap smear if needed. They can look at the cervix. They can see and ask questions. Are you having any bleeding? And then if there are any reasons to undergo a biopsy, then obviously that's the next step.
That's excellent. So if somebody comes in early and you do a biopsy and you confirm that it is cancer, endometrial cancer, what are the options for the woman?
For treatment, right?
Yes.
So I think it all depends on what stage and
it is.
age of life. So the first thing we would do is we would do obviously a scan to make sure that the cancer hasn't spread outside of the uterus, because then the treatment is different. But most women, about 60 to 65% of women, are actually diagnosed when the cancer is still confined to the uterus itself. So that's why I keep saying that this is something that we can treat and we can cure. So in most of these women, if they're done with having children, then the treatment is usually a hysterectomy. So taking out the uterus, the cervix, the tubes and ovaries, and we also do something called sentinel lymph node biopsies. So we do biopsies of certain lymph nodes which can drain the uterus. In the past, the surgery used to be done, by making a big incision. Now, most of us, even in India, this surgery is done minimally invasive. In the US, majority of these cases are done robotically. In India, we are doing a lot of these laparoscopically, but they're still very effective, and it's a very effective treatment for this cancer.
There are many robotic centers as well.
Exactly.
In India, yeah.
Exactly. Now, in women who are diagnosed with, say, endometrial cancer, like I said, it is kind of getting more common in younger women, right? So if there are women who are younger who are diagnosed and they still haven't finished childbearing, and if it is a low grade means a grade 1 cancer, which means it's not very aggressive, sometimes in these patients we can treat them with a drug to kind of counterbalance the excessive estrogen. So we are sometimes treating these patients with either oral progesterone pills, or we actually put an IUD, which releases progesterone in the uterus.
Intrauterine device.
Exactly, an intrauterine device, just like a copper T. So what it does is it allows to counterbalance that excess of estrogen. And in a lot of patients, about 65% of those patients, we will see regression of the endometrial cancer, so that enough that hopefully they could try for pregnancy after that.
So that's very encouraging. But the most important thing you're mentioning is that to reduce the risk factors that are modifiable lifestyle.
Correct.
Risk factors, and then come for regular checkups.
Exactly.
And watch for any abnormal
bleeding.
Yeah, something doesn't sound right.
You should
see
go
your
see your
doctor.
gynecologist.
And under doctor's supervision, weight loss and all of these things can be very helpful to reduce the risk factors and the risk for cancer. Is there any other message you would like to give to the women?
Sure. I mean, I think one of the things that always people ask me when they see me is, is this something that is passed on, right? Is this a family? Can I pass it? If I have it, can my daughter get it, and things like that. So there is one syndrome that is associated. It's called Lynch syndrome. So there are now very easy tests that we can do. So anyone who's diagnosed with this type of cancer before the age of 50 should undergo genetic testing. It's a blood test. Because what's important is, yes, we know you have cancer of the uterus, but it also can be linked to cancer of the colon. So we know that these patients need screening. So if you have a family history where you know many of the people in your family had, you know, a hysterectomy, women had hysterectomy for cancer, it's always probably good to try to find out what type of cancer it is. And then if it is a high risk of, say, endometrial or colon cancer, then you are eligible for genetics testing, which is very easily available even in India or in other countries. And that will help you a lot of the times to, you know, not just treat this cancer, but also will help you decide what are the screening you need to do.
Yeah, and for other family members.
Exactly, for other family members as well. Correct.
So, Dr. Kamat, that's very, very, very informative and very encouraging as well, because somebody can help themselves.
Absolutely.
And thank you so much. Obviously, all the recommendations are general recommendations, and you need to see your gynecologist or your physician for any of these. But most important is, you know, stay safe, stay healthy, keep healthy, and see your doctor regularly. Thank you.
Thank you so much. Thank you.